Line of Duty stars Adrian Dunbar and Vicky McClure say they're worried about those with dementia as we face further lockdowns and more restrictions. For both, it's an issue close to their heart. Mr Dunbar's 88-year-old mum has had dementia for 7.5 years and is in a care home in Northern Ireland. Vicky McClure's BBC programme, Our Dementia Choir, showed how music could help and stimulate people with the condition. Here she is, introducing the singers at Nottingham's Royal Concert Hall last year.
Welcome to the Royal Concert Hall. I knew I could rely on you.
Very nervous. It's been a great journey and I've made a lot of friends. But I don't want to mess it up. I want to do it just right, and I don't want to let everybody down.
Without further ado, Nottingham, may I introduce to you our choir. They are all living with dementia. But they want to show you, despite that today, they can achieve incredible things. Our choir! Dementia Choir, come on! This is Bernard. Here's Maureen. There's Morris. He was the Nottingham singing landlord.
It was such a moving programme. Right, let's talk to both Vicky McClure and Adrian Dunbar, who are taking a short break from filming to talk to you. Good morning.
Good morning.
Thank you very much for talking to us. I know this is an issue that's really close to both of you. Adrian, let me start with you. How worried are you about people like your mum and others with dementia as we face further restrictions?
Well, I am worried, and it's being flagged up in the news last night. You know, these are the most vulnerable people in our society, and I remember right at the start of the pandemic that we kind of lost sight of that, and there was very low numbers here in Northern Ireland and very few deaths, and yet we kept testing, you know, the workers who were nurses, doctors, quite rightly so, but we forgot the care homes were sort of left behind, and it's the people moving in and out of the care homes who really need tested, because the people in the care homes do have a lot of background health issues, etc., etc. So I hope they're not left behind this time, and I hope they're focused upon at this point.
And Vicky, how would you say your friends from the Dementia Choir have fared in the last few months?
I actually reached out to everybody the other day and asked for their comments. Majority of our choir aren't in care homes. We have got some members that are in care homes, but a lot of them some are living on their own. Some people just need their friends and family, and that is their main source of care. And I think that has been really difficult because they've not had, you know, the option to have people there, and the restrictions now with the 6, trying to make that work is also going to be difficult. But yeah, I mean, I spoke to them and I did ask them for some examples that I've written down here just because I wanted to get it right. Yeah. Because it's from their words. And, you know, just simple things like one-way systems in the shops has been difficult. Talking has declined, their physical and mental health. And even Maureen, who we actually lost, sadly, a couple of weeks ago, she didn't understand the virus and she kept trying to brush it off. It's very complicated. It's very complicated for us to understand. So for people that are living with dementia, it's, you know, it's a very, very confusing time, and they really need their friends and family around them. And
they need the stimulus, you know, I mean, because everything starts to fail if you're not being stimulated all the time. I mean, my mother is in a care home, as you say, just outside of my hometown of Enniskillen. You know, my sisters and the family gets to see her and talk to her, you know, at a distance where she can come out to the door. But, you know, all these people, they need stimulus all the time. Otherwise, all the faculties and facilities start to drift away.
Well, that's exactly right. And there are some care homes, and Vicky, I take your point that not everyone with dementia is in a care home, but if I can just follow this through with Adrian for a moment, there are some care homes who, you would argue quite rightly, are now stopping the visits again. The socially distanced visits, the visits through plastic screens because of this rise in coronavirus cases. But I wonder if you think, in the name of infection control, that some potential harm is being inflicted on some patients with dementia, Adrian?
Well, yes, obviously, you know, this is a trade-off between, you know, really the basic thing of just staying alive or a deterioration in the patient. I mean, it's a terrible scenario for the people in the care homes. But the staff in the care homes, I mean, a lot is resting on what they do now, how they respond themselves to it, and we have to give them support. because they are the link between the people inside and the people outside. So if we are going to close the care homes down, we have to support the staff who are working in them. That's my opinion.
Vicky, I'm struck by what you said about your friends from the dementia choir, you know, the sort of deterioration, I suppose, in the condition of some of them because of the lack of being able to see people that they love. But yet they have avoided the virus.
Yeah, I mean, everybody's trying to avoid the virus. We have had some members in the choir that have had the virus and luckily got through it, thank God. You know, just in the clip that you showed there, you heard Ray talking about how she didn't want to let her friends down and she was really nervous and she was just about to go on and perform. And Ray, as an example, lives in assisted living and she lives on her own and she hasn't seen anybody for 6 months until sort of 2 days ago when some of our choir members actually went to visit her because she was allowed a visitor. So she's been alone for 6 months and all she's seen is the carers and she's, you know, she speaks very highly of them and they've been brilliant. But to see family and friends and not be able to see these people, you know, Ray, the singing for everybody in our choir, the music and the interaction, everything that brings, you know, it might only be once every few weeks, but we've lost that now. And it has made, you know, it has changed people's lives and it has meant that every single person in the choir has deteriorated in some way because it, you know, like Adi was saying, it stimulates people in a way that we don't realise the power that it brings just interacting with people. And, you know, if we can encourage care homes especially to try and enforce that and just make sure that there is things that are happening. I know some care homes are really good at it and it's something that they're quite famous for, some of the care homes that I've visited. But there's some that just don't have the facilities and sometimes all you need is a speaker or somebody to be able to play a guitar, whatever it is, trying to get something in there just to keep people's, you know, spirits lifted, really.
How is your mum, Adrian, if you don't mind me asking?
My mother, you know, she was always a positive person all her life, and that seems to have bled through into her Alzheimer's. And she, you know, she keeps positive when we go to see her. She's always positive with anybody who comes to see her. So thankfully, within herself, she's an extremely positive and always been an active person. But I do know that. You know, she could really benefit with singing. She's been a singer all her life. She could benefit with all that kind of, she loves people. She's always worked with people also. You know, she likes the environment of being with a lot of people, so that suits her. So there are things that suit her, but for other people, that may not be the case.
Okay, well, thank you very much for talking to us because there'll be many, many people watching who are in a similar position to yourself, Adrian. And to you, Vicky, who've got friends with dementia, relatives with dementia. I'm going to ask you about you both sitting on the sofa together because someone will complain about the fact that you're not social distancing. So just explain clearly you must be in a bubble for filming.
Yeah, we are in a bubble, Vicky and I, for filming. And so we're being tested every couple of days. And so, you know, we're following the rule very strictly.
Yeah. Thank you very much. Really appreciate it. Thanks for talking to us. Thank you.
Thanks a lot.
Bye now.
Cheers.
Thank you for your messages about relatives with dementia. This from G on Twitter, who says, my dad has Alzheimer's. He's really missing his Alzheimer's group. Mum is also missing her carers group where she can get respite from dad for an hour. It's awful watching them being so secluded from everyone. Andy has emailed to say, my mum has dementia and I haven't seen her properly since March. She is a care home resident. Sadly, I still can't get to see her and her life is now coming to an end. I can see her through the window. As this is the closest I can get, she is now bedbound, she's not eating and she's not drinking. She has lost so much weight. The care home staff are doing a wonderful job. It's a very, very sad situation. Well, let's talk now to Dr. Hilda Hayo, the Chief Executive of Dementia UK. Good morning to you, and we're speaking to you today because of those concerns. We heard from Line of Duty's Adrian Dunbar and Vicky McClure. Dementia is, of course, very close to both their hearts. What is the situation now that we have this rule of 6 when it comes to particularly those with dementia in care homes?
In care homes, there's been a problem with families visiting since March, since the lockdown, and that hasn't really changed an awful lot in some parts of the country. And the fear is that if the rule of 6 actually starts to kick in, there could well be no visiting up until about March, April of next year, which obviously is not acceptable for families and for people living with dementia.
What might the impact of that be if that does come to pass?
I would say for the residents, more social isolation, a lack of understanding as to why their relatives aren't visiting, feeling that have been abandoned. We've certainly had on the Admiral Nurse helpline, we're certainly getting calls from family members who are saying, because of the lack of visiting, when they do a window visit or when they're doing an iPad visit, what they're finding is the relative seems to have deteriorated considerably, particularly psychologically and cognitively.
But what do you do? I mean, the care homes have to protect their residents from coronavirus.
Absolutely. I think that we've actually sent a letter out to Matt Hancock and Jonathan Ashworth in May and then in July of this year, suggesting some things that could be done to enable safe visiting to take place. One of those is about regular testing. So the relatives should be tested in the same way as the care staff are. We've also spoken about PPE being available for people that are visiting. And we've also said that we should have a situation where the government is giving a little bit of clearer guidance to care homes rather than leaving it on a case-by-case basis, because we're finding that some of the care homes, quite rightly, are concerned that people are going to be bringing in COVID within their care settings. But we're already seeing that the increasing rate of COVID within the care settings is coming from the staff, not from the relatives.
Let me read you this email, if I may. This is from Karen, who says, my mum's best friend is 94. She has all her faculties. She went into a care home a couple of weeks before lockdown. She might as well have been in a prison cell. She's not been allowed to mix with other residents, no visitors, not even through the glass or outside. She's in a small room all day. My 88-year-old mum is so worried about her. I mean, if there is someone watching who is worried about somebody in a care home, what's the right course of action? What should they do?
Speak to the care home manager. This is the first port of call. Explain what the situation is. Explain that they would like to visit. They'd like to visit safely. Ask whether it's possible for them to have a test. So if the person is free from COVID, they're able to visit to see that mother. On top of that, we've got the Admiral Nurse Dementia helpline. Give us a call. We're open 7 days a week and we can give specific advice on a case-by-case basis.
And finally, are you at Dementia UK backing the organisation John's campaign, which is campaigning for a judicial review for the government's guidelines when it comes to visiting care homes?
Yes, we are indeed. John's campaign is part of the One Dementia Voice group. 10 leading dementia charities of the UK are all a part of this One Dementia Voice, and we're all asking for the same thing. So we're supporting John's campaign.
Thank you very much for talking to us this morning.